Abhijit Sarbadhikary, consultant orthopedic surgeon. I have been associated for a pretty long time with Neotia Mediplus on 6 Rawdon Street. I would like to discuss a very common ailment that is troubling a lot of people, সেটা হচ্ছে knee jointed osteoarthritis. Knee jointed osteoarthritis, if you look around yourself or in your family or friend circle, you see that after 40, 45, nowadays even younger sometimes, people have started complaining of pain in the knees. It is also a lifestyle disease nowadays because more and more people are suffering from lack of exercise, number one, and more than that, obesity. Because it is basically becoming a lifetime life care and lifestyle problem, because there are certain things which are conducive to the exaggeration of the symptoms. What it is basically, if you think of it, what is knee osteoarthritis? Knee osteoarthritis is the breakdown of, think of a knee joint, even in a chicken or something. The bones don't end in bones. The bones on both sides of the joint don't end in bones. They end in cartilage, which is the shiny, very smooth tissue which separates the bones. It's called cartilage. Now, with age and with rubbing, with weight increase, with the increase of uric acid in the body, many other factors, that gets eroded. It becomes pieces, microscopic pieces called debris, and that irritates the joint. Why does it irritate joint? It's like a foreign material. So the tissues around, soft tissue around that increases, there is swelling. Now that swelling causes weakness in the muscles which are supportive of the joint movement. Now these muscles, when they become weak, you cannot hold the knee joint in proper shape, or during motion there is much more movement or friction than it was before. So it is again leading to formation of more debris, more loose particles, and that is again conducive to erosion, progressive erosion of the cartilage. And the time comes when the erosion is so much that the bone is rubbing against the bone, is that intolerable, so people going for total knee replacement. Now, what are the three things? Because this is a short presentation, just going for very simple three things. One is a kind of drugs which are anti-arthritis. It's called disease modifying drugs that can decrease the rate of this destruction of the cartilage. Number two, yes, certain lifestyle things. You have to walk but not too much. The weight has to be decreased. The obesity is the prime cause of this. And then there are uric acid, vitamin D3. There are several other factors. You should have your blood sugar checked and uric acid checked and vitamin D3 checked. And if there is a problem, then treat that. That is also the second part. But I would give less importance to this, the first part, the disease modifying drug, and the other problems that may be running concurrent. But the main thing is exercises. Because what is the problem? Your muscles are getting weaker, so there is more and more friction. If you get the muscles right, so I would say the prevention of osteoarthritis depends very much on exercise, which are very simple exercises to strengthen your quadriceps, the muscles in the front of your knees, and the hamstrings, which are in the back of your thigh. So those muscles are to be exercised in a very regular fashion, and certain other indications are there for. There are several stages of this operation. There are certain other procedures, but unless you really have a check on that, it will all end up in the total knee replacement. That is obviously expensive. That's a good solution, but you don't want that basically. So you have to consult the doctor early and to prevent the chance of having a TKR, because after all it's a foreign material and you should better not have it before you are 60. So initially exercise, understanding the situation, exercises, conservative treatment.